In the next 30 minutes, I will introduce you to the myofunctional philosophy, the idea, the treatment options, and the different appliances that can be used by speech therapists. My name is Niels Hulsink. I'm the International Training and Product Manager for MRC Europe since 20 years. The main job that I'm doing is supporting the dealers in the different countries like Dental Focus in Romania, and I'm lecturing all over Europe to explain the treatment that comes with all different appliances. Our mission: MRC develops simple, innovative appliance systems and education programs for health practitioners around the world to treat the breathing and myofunctional causes of malocclusion, TM joint, and breathing-related sleep disorders. So let's talk about breathing.
Every system in your body relies on oxygen, making breathing an essential function for life. Your nose is perfectly optimized for breathing, as it warms, humidifies, and purifies the air you breathe. During nasal breathing, the lip muscles are sealed and relaxed. The tongue rests against the palate, and this creates a normal swallowing pattern. The upper jaw is developed by the tongue, and the correctly functioning lip and cheek muscles keep the teeth aligned. During mouth breathing, the lips open, the tongue descends from the palate, the cheeks push the teeth in, and an incorrect swallowing pattern emerges, which all combine to restrict jaw growth and crowd the teeth. The incorrect swallowing pattern pushes the lower jaw backwards repeatedly, causing dysfunction in the temporomandibular joints, or TMJ, and potentially causing long-term damage. Changes in jaw and head posture result as compensation, leading to tension and inflammation in the head, neck, and back muscles. The resulting symptoms are diverse and may lead to clicking in the joints, as well as aches and pain in the head, neck, and back. This problem is known as TMJ disorder, and when left untreated, progressively gets worse over time. Mouth breathing is medically recognized as a form of sleep-related breathing disorder, or SRBD. With its restrictive effect on jaw growth, untreated mouth breathing acts to further reduce airway space over time and worsen the SRBD. The severest form of SRBD is known as obstructive sleep apnea, or OSA. This is where the tongue falls into the throat and the airway muscles lose their strength, resulting in collapse and obstruction of the airway. Sufferers can wake up multiple times per night and have an increased risk of cardiovascular problems like heart attacks and stroke. TMJ and breathing disorders are interrelated chronic health problems that affect countless people worldwide, many of whom continue to suffer undiagnosed and untreated. Traditional approaches to TMJ and airway issues only address the symptoms, while doing little to treat the underlying contributors. Speak to your health practitioner about how to achieve the best and most stable results for breathing and TMJ disorder by treating the underlying factors.
So to avoid a lot of problems later on when the child is becoming an adult, we need to start on time. But before we start continuing talking about appliances and the treatment options, it needs to be clear what is the problem with mouth breathing. The next patient you will see tomorrow, next week, in your practice, you need to start the conversation. Parents have no idea, and children got no idea what is wrong with mouth breathing. So the moment you recognize a mouth breathing patient, you need to start to explain what is the problem with mouth breathing and why nose breathing is good for your health. The main problem with mouth breathing is the lack of oxygen, a low oxygen level due to the low carbon dioxide level. So oxygen level is related to carbon dioxide. To increase oxygen, to make sure that more oxygen is transported to body cells, we need to increase CO2 level. And therefore we have different breathing exercises. And most of the breathing exercises are training the brains, the system, to deal with a higher level of CO2. And with the more CO2 we can deal with, the more oxygen is transported to the body cells by hemoglobin. So if we are mouth breathing, the heart rate increase, that can create stress. That can produce cortisol, the fight-flight response. And due to that, the quality of sleep, the quality of nighttime sleep is very poor. So then we start talking about sleep disordered breathing. If the quality of sleep is poor, we will have an effect during daytime. We talk about mouth breathing for weeks, for months, and for years. So during daytime, we will see learning difficulties, behavioral problems, teeth grinding, daytime sleepiness, restless legs, bedwetting, venous pooling, concentration problems, and headaches, all related to the poor quality of sleep. We also talk about hyperventilation when we have mouth breathing patient. We have an increased susceptibility of infections. We have increased allergic risks, and we talk about asthma as well. If we are mouth breathing, the tongue is also in an incorrect position. So the low tongue position will create an underdeveloped maxilla. And an underdeveloped maxilla will have an effect on the growth of the mandible. And that's creating the different malocclusions and the orthodontic problem. There, the tongue is attached on the mandible, and the mandible is backwards, the tongue is backwards. And this creates snoring, obstructed sleep apnea, and TM joint problems as well. So this is the full circle of how mouth breathing is affecting the full body, the full system. And therefore it's needed to do exercises as well by wearing the different appliances at nighttime and during the day. So the screening for breathing and sleep disorders start when they walk into your practice. So next Monday, when you're back in your practice, start screening the patients and start the conversation. Therefore, we have an evaluation form, and this evaluation form makes it very easy to evaluate, to screen the patient. And within 5 or 10 minutes, we know where are the problems and how are the relations of the problem. How is breathing related to posture? How is breathing related to swallowing? How is swallowing related to facial development, etc.? The evaluation form got 3 sections. The first section is the dental alignment, the arch form, the occlusion, and the facial development. The second section is the breathing and posture, the tongue, the swallowing, and the lips and cheeks. And the last section is the myosa screening, the breathing screening, the habits, and the TMD, TM joint screening. Especially this part, the myosa screening, is a screening that we can check the level of the breathing. We can do different tests like BHT, PACES, NB10 and NB3, and these tests makes it possible within a few minutes to know how is the level of breathing. Is it easy to breathe through the nose for the patient, or is it difficult? Are there any obstructions? Do we need to referral to an ENT specialist? All these things we need to know before we start any treatment. The breath hold time is a very easy test we can do. Within 1 minute, you know how is the level of breathing. So I hope next time you're back in the clinic from Monday, you start doing the breathing test if you notice any difficulties with breathing, mouth breathing, or nose breathing.
Breath hold time test. Stand up straight in a comfortable position with the correct back and neck posture. Take 2 breaths in and out through your nose without strain. After the second breath out, begin holding your breath. Start your timer as soon as you begin holding your breath. Measure how many seconds you can hold your breath and stop the timer as soon as you feel the distinct urge to breathe again. It is important to remember to keep your lips together while you hold your breath during this activity. Write down the number of seconds you were able to hold your breath. Repeat a few times to ensure a consistent time and record your average time.
So the breath hold time is a simple test, and within 1 minute, you know the level of breathing. In a normal patient, in a normal breathing, normal nose breathing, the breath hold time should be above 25 seconds. So you can do the test yourself, you can do the test with your patients, but there is a level of mentioning good or not good. So 25 seconds plus is good, and less than 25 seconds is not good. And you may need to check some other things as well, like allergic problems, etc. The direction of use of Myoza appliances. The Myoza appliances have all the same features, like the tongue tag, the tongue guard, and the lip bumper. All the Myoza appliances are worn nighttime and 1 hour per day, every day. In treatment, we know we have 2 or 3 different phases, and we use all phases in treatment. Each phase is approximately 4 to 6 months. So an average treatment of Myoza is around 12 months. It's also possible and needed in most of the cases to add myatalia and the Myoza activities for active support. If you wear the Myoza appliance directly, you will correct 4 different habits: nose breathing, correct tongue position, correct swallow, and lip sealing rest. The first group of products that I want to talk about is the Myoza for kids. The Myoza for kids are 2 different appliances used in the age group between 3 and 15 years of age. The KS1 and the KS2. Both appliances are available in 3 different sizes: small, medium, and large. So this means we can use them in all dentitions: primary, mixed, and permanent dentition. The KS1 and the KS2 are different. This means that the KS1 makes it possible that the patient is able to breathe through the mouth, and with the KS2, nose breathing is needed. So therefore, the BHT, the breath hold time test, is needed to decide with which appliance are we going to start. This is the KS1. Again, the KS1 is used in the age of 3 to 15 years of age. The KS1 is really flexible, the soft material, really comfortable for the patient. It got large breathing holes. This means that the patient is able to breathe through the appliance, through the mouth, so it will not fall out easily during the night. So when there are any difficulties of mouth breathing, of nose breathing, with the KS1, it's possible to breathe through the mouth. There we got the air spring base, and the air spring base is needed for young patients to masticate the jaw muscles, to train the jaw muscles. A lot of patients, 2+ are having still an infantile swallow, an incorrect swallow, and to correct this swallow, it's needed to train the jaw muscles. And therefore, this open molar area, this air spring base is needed. And of course, we have the tongue tag. The tongue tag is the main feature in all our appliances and is retraining the tongue. The KS2 is the second phase of the appliance, but only needed when used when breathing is okay. So when the patient is able to breathe through the nose, we can switch to KS2, or we can start with KS2. It's again a soft, flexible appliances. It got smaller breathing holes, so breathing through your mouth is not easy with the appliance. It got a tongue tag to retrain the tongue position, and it got a tongue elevator to lift the tongue, to create a correct tongue position, and to create a correct swallow. The appliances are used nighttime, 1 hour per day, every day, and each phase of treatment, KS1 and or KS2, is used for 4 to 6 months each. Then the second group of products I want to talk about is the Myoza for TM joint BDS. This is the adult series of the Myoza appliances. We have the Myoza Kids 315, and we have the Myoza TM joint BDS for adults 15+. Now we start talking about sleep disorder, breathing patients, snoring patients, severe mouth breathing patients, and patients that have some TM joint problems as well. In the TM joint BDS system, we have 3 different appliances: S1, S2, and S3. And they all can be used in one treatment. But also here, it's important to do breathing tests and to know which appliance are you going to start with. The S1 is a flexible silicone appliance that is opening the bite more than 5 millimeters. So mouth breathing is really easy because of the big, large breathing holes. This is also an appliance that is often used in snoring patients. The appliance is opening the bite and bringing the mandible forward. And that's what we want with snoring patients, to reduce the sound. So the mouth is going to be opened and the mandible is moved forward. The features are high sides, so the soft tissue is away from the teeth. It got an active tongue tack, so we can do exercises with the tongue tack as well. It got large breathing holes to breathe through your mouth, and it got thicker base. It opens the bite and it's moving the mandible forward. So this appliance is very useful for mouth breathing patients, snoring patients. The second appliance is the S2. The S2 is less high, the breathing holes are smaller, and mouth breathing with the appliance is more difficult. This is an appliance that needs a breath hold time of 20, 30 plus. So you need to be able to breathe through your nose. To use and to start with the S1, the previous appliance, is used in patients with poor mouth breathing and poor nose breathing. This means the breath hold time is less than 20 seconds. So the patients got difficulties to breathe through the nose. That's when we start with S1. When breathing is okay, we can start with S2. So we don't need to use both. It depends on the breathing level of the patient. So the S2 is very effective for nose breathing patients, snoring patients, patients with TM joint problems. This appliance, due to the optimum jaw positioning, is very comfortable to wear and is very effective for patients that have some TM joint problems. It's repositioning, it's slightly rotating the mandible, what is also decompressing the TM joint, and gives some relief if there's any pain caused by the TM joint. The tongue tack, the lip bumper are all the same features like every appliance. The S3 appliance is the last stage we use in the TM joint BDS series. It's the appliance to finish the treatment, to get some retention. We corrected some functions like breathing, tongue position, swallowing, snoring, and now we need some retention period of these corrected habits. So the S3 is not high, it's a low model. The breathing holes are very small. It's not possible to breathe through your mouth with the appliance. It got the tongue tack, it got the lip bumper, and it's flexible and a comfortable appliance to finish the TM joint BDS treatment. All the appliances, S1, S2, and S3, are worn nighttime and 1 to 2 hours per day. In adult cases, in patients 15 years plus. Besides wearing the appliances like Myobrace for kids, Myobrace for adults, BDS, it's important to do exercises and to start an active program. We have 2 different programs going to be introduced very soon. They are not available yet, but they will come in the next month. The Myobrace Kids activities and the Myobrace Adults BDS activities. The Myobrace activities are supported by Myitalia appliances as well, like the TLJ and the lip trainer. I will talk in a minute. But first, I would like to introduce you to the new, coming soon, Myobrace Kids and Myobrace Adults active program.
Hi there, my name is Andrea.
And I'm Ben.
And we're going to teach you some fun ways to improve the way you breathe, as well as strengthen your tongue, lip, and airway muscles.
These simple exercises are called the Myobrace activities, and it's important you do them every day in combination with using your Myobrace and Myitalia appliances.
Before we begin, it's important to understand how breathing, where you keep your tongue, and how you swallow can affect your overall health. So, let's get started.
So this is a series of exercises coming for kids, so in the age of 3 to 15, to support the Myobrace Kids KS1 and KS2 appliances. There will be a website coming with all the videos and instructions, and there will be booklet coming, a Myobrace Activities Kits book with all the exercises explained. For the adult patients, for BDS, we have the Myosa for adults or the Myosa for TM joint BDS.
Hi there, my name is Maya.
And I'm Tim.
Together, we're going to help you retrain your breathing and muscles to function better. By completing simple activities, we will assist you in your treatment with the Myosa TMJ BDS appliances that you've started using.
We now know that the cause of jaw joint problems, also referred to as TMJ disorder, as well as breathing and sleep problems, start in childhood with mouth breathing and incorrect oral habits, known as poor myofunctional habits. These incorrect habits restrict jaw growth, and although it may be more difficult to address jaw development problems in adulthood, this activities program can assist in achieving better health outcomes. TMJ-BDS is an abbreviation for problems relating to teeth, muscles, jaws, breathing, and disordered sleep. Patients with TMJ-BDS generally have mouth breathing habits which lead to poor strength of the lip, tongue, jaw, and throat muscles.
In this activities program, we will focus on breathing efficiency, treating some of the bad swallowing habits, and improving the strength of the tongue, lip, and airway muscles. After this, your practitioner may recommend other forms of treatment to develop the jaws for further improvements in your health. The goals of the Myosa activities are to establish correct light nasal breathing, strengthen the tongue, lips, and throat muscles to improve the function of the muscles during sleep. Establish a correct swallowing pattern to stop damage to the jaw joints.
Combined with Myosa and Myotalia appliances, these activities will assist in relieving your symptoms and help treat the causes of your problems.
So why don't we get started?
So the Myosa Activities Adults TM Joint BDS website is ready and will be launched soon for all practitioners to enter that website and to use all the different exercises. In the Myosa Kits, we have 17 different exercises. In the Myosa Activities for Adults TM Joint BDS, we have 21 different exercises. The exercises are mostly done with Myotalia appliances. Myotalia is a system with 5-6 different active appliances. These appliances are not used nighttime 1 hour per day, but these appliances are only used for daytime use when doing exercises, between 5 and 15 minutes per day, sometimes twice per day. In the Myotalia, we have the TLJ, the TLJB, the TLP, the lip trainer, the lip seal trainer, and the MyoChew. Quickly, I will show you all different appliances because these appliances are very well and very often used by speech therapists to support their active treatment. The TLJ is the biggest and most used appliances because with the TLJ, we can do 6 different exercises on lip, on tongue, on chewing, on breathing in 2 different head positions. This means we have 12 different exercises with 1 appliance. The TLJ appliance is available in 3 sizes, small, medium, and large. So it can be used in all dentitions and all age group. It got an open lip press tube, it got an open tongue press tube, it got an air spring base, and is very flexible. So I can do lip training by closing the lip tube. I can do tongue training by closing the tongue tag, and I can do chewing and mastication training by biting and chewing on the appliance. The same version we have also for use with brackets. So when you have an orthodontic patient already with braces, we can use the TLJB with the same features and the same exercise program. So again, the TLJ gives you the option to do 6 different exercises in 2 head positions, so you can do it 12 exercises with 1 appliance. This is really a must-have in every speech therapy practice. Then we will have the lip trainer. Also, the lip trainer is used in the Myosa Kids activities. There are exercises done with the lip trainer to train the full orbicularis oris muscle. An exercise that means that we start pulling the lip trainer and we start stretching the lips. I can pull up, I can pull down, I can pull forward. Every time, every day for 10, 20 minutes, pulling the lip trainer and training the lips. The lip trainer comes with a lip seal trainer. So when you buy one appliance, you get actually two different appliances, the lip trainer and the lip seal trainer. And the lip seal trainer can be used additional. Besides Myosa, besides using the lip trainer, you can use the lip seal trainer during daytime more often to make the patient conscious to seal the lips. When they are reading, when they are watching TV or playing a game, you can place the lip seal trainer between the lips and to make sure that the lips are sealed all the time. Then we have the TLP. The TLP is a simple version of the TLJ. What you can do with the TLP is you can do lip training exercises and you can do tongue training exercises. This means you can place the TLP between your lips and you can put the TLP in your mouth and you can use it like a tongue tech, an active tongue tech, and do tongue training exercises. The last appliance in the Myotalia system is the MyoChew. And the MyoChew, like the TLJ, is a very popular appliance within speech therapists because what they want is continuously training of the tongue position, the breathing, and the swallowing. A lot of children, 2+ are still having an infantile or an incorrect swallow. To change this swallow, to correct the tongue thrust swallow, you need to train the jaw muscles. And this appliance is really helping you with that. It got an open mole area, it got an open tongue tech, it got bristles to also to clean the teeth and to masticate the gingiva. It got a strap to use as a key cord and to use for pulling. This is not an active appliance that you have to pull the appliance, but you need to hold it while you do your chewing exercises. It's soft silicone, it's really comfortable, and the best age of using the MyoChew appliance is between 2 and 8 years of age, but most use between 2 and 4, 2 and 6 years of age. Also, the MyoChew is very often used instead of pacifiers dummies. When you have a patient still using the pacifier, you can replace it for the MyoChew. And the MyoChew also is used when the patient is too young to start a full Myosa Kids treatment. So when the KS1 or KS2 for nighttime wearing and 1 hour per day is too much, the child is not ready yet for a full treatment, you can use or you can start with the MyoChew as more a playing tool. The MyoChew is only worn daytime whenever the child wants and whatever for how long. A patient of 2-3 years of age, you don't give too many instructions. You give the appliance and you see how they start wearing it. And when they are very active and willing to wear it, you can switch from MyoChew to Myosa KS1 or KS2. So then I'm almost at the end of this 30 minutes course. Let's talk about getting started. Next week, you're back in your clinic, and there are a few things you have to take care of. Make sure you have a special area for Myosa where you can treat the kids easily. Make sure you get this treatment guide. I will send a PDF of this presentation to Dental Focus, to Alexander, and he will forward it to you if possible. So the PDF of this presentation will be available soon. There are evaluation forms available. The workbooks are coming. You need to have a TLJ and lip trainer appliance in your practice so you can do always an active program besides wearing any appliance or doing any active program yourself. You need the MyoClean tablets to clean the appliances twice a week. We have a grid poster as a PDF. You can print it. This grid poster makes it perfectly possible to take good photos of face, profile, and posture. And we have just introduced last week the Myosa sample set box. And the Myosa sample set box got all different appliances, KS1, KS2, S1, S2, S3, and the TLJ appliance. This box can be used also for sizing. This means when you have a patient and you're not sure which size of the KS1 or KS2 is perfect, you can try from this box. You can try the small, you can try the medium, you can try the large, and the correct size you can order directly, so you don't have a mistake. All soft appliances in this box you can autoclave or you can cook, boil in boiled water. So everything is possible. Don't worry about that. So what are your next steps? Find a child-friendly Myosa area to treat all your patients. Train yourself as well and your staff. Start screening all your patients and start the conversation. What's wrong with mouth breathing? Why nose breathing is needed, etc. Select at least 5 to 10 patients and start your cases with Myosa or myetalia. Get the MRC treatment guide and learn more. And register on the Myoresearch website and get access to all online courses. There are different possibilities to get access on the website. There is a basic account for free. There is a monthly subscription for $40, and there is a yearly subscription for $350. And this gives you access to all the online material, all the courses, webinar, training sessions, workshops, etc. So please have a look on the website. If there are any questions for me, please send me an email, info@myoresearch.nl, and there are 3 different websites for you to visit: myoresearch.com, myosa.com, and myosaactivities.com. If you scan this QR code, you come directly to the online platform and you can register on the different levels. Thank you very much and have a good conference for the rest of the day.